Welcome to the Totally Adequate podcast, produced by Quest Analytics. Here, we dive into the latest news, policies, and innovations in healthcare provider network management with industry leaders who are shaping the future of care. Our mission? To elevate community health across the nation through superior provider networks.
Welcome to the Totally Adequate podcast. I'm Kate Deiters, and today I'm joined by Zach Snyder, our VP of Government Affairs at Quest Analytics. We are here to discuss the new network adequacy rules for health issuers on the federal and state exchanges. Zach, as always, it's great to have you here to help us better understand these changes.
Yeah, thanks for having me and looking forward to talking about these policy items today.
We are too, Zach. Before we jump into the changes, I want to give everyone a little bit of background about the rule we're discussing today. The Notice of Benefit and Payment Parameters is an annual rule issued by the Department of Health and Human Services and the Center for Medicare and Medicaid Services. It sets the standards for the health insurance marketplace, including network adequacy and provider directory accuracy requirements. These are requirements that health issuers need to follow if they would like to sell their products in the marketplace. When we discussed the proposed rule in a previous episode, we talked about the possible change to network adequacy distance calculations. Specifically, CMS was proposing to shift from its current estimated driving distance to using a new geographic distance calculation. Did they go forward with this change?
Absolutely. So what we saw proposed in the Notice of Benefit and Payment Parameters, at least as it relates to network adequacy, was finalized that way. So CMS announced it is enhancing the accuracy of time and distance metrics by adopting a new methodology that uses geographic distance instead of estimated drive time. They say that this method will account for real-world conditions such as terrain and infrastructure, and that it will provide a more accurate assessment of network gaps.
In reading through the final rule and the letter to issuers, CMS mentions that having this additional insight into the physical landscape will help them better adjust the time and distance standards in the future if they need to. For example, is a body of water affecting a patient's access to care within the set time and distance standards? Does that body of water make it unrealistic for a health plan to contract with a provider and meet network adequacy requirements? They also see this as having a ripple effect into helping health plans with their network adequacy justification process. Do you see geographic distance calculations being beneficial for CMS in these situations?
I do. I think CMS is using this geographic distance calculation to inform their justification process going forward. I think that there's a desire for them to automate it more, to make it easier for health plans to apply for those exceptions and be granted those exceptions. And one way to do that is to use the real world access reports that are generated by using geographic distance calculations to determine what the real time and distance metrics should be. And they could be adjusted on a yearly basis as well, depending on provider supply and other factors in the market.
Last year, CMS had said that state-based exchanges at a minimum have to bring their network adequacy requirements into the same as the federal exchanges. Are they counting this new methodology as part of that?
CMS is not requiring geographic distance calculation as part of their requirement from last year to state that the SBEs must adopt the same standards as SSIO or have standards that are just as stringent as SSIO for the QHPs in those markets. They have not applied the geographic distance requirement to those states, but bringing it in at the federal level this year, we can guess that in subsequent years, they may look to bring that to the states as well, that requirement at least.
Zach, while we're talking about the state-based exchanges, can you remind our listeners what are the network adequacy requirements that states need to bring their requirements into at a minimum by January 1st of 2026?
Yeah, well, the main ones are requiring the state-based exchanges to adopt those standards that mirror the SSIO standards. So adopting the 40 plus provider and facility specialty types using the county-based geographic designations. And then the second major piece of that is requiring the states to adopt a certification process. So actually reviewing the filings issued by the plans and determining whether or not they meet those requirements prior to certifying that plan as a QHP. In some states, there wasn't a review going on. There was an attestation or something else happening. So CMS is requiring states to adopt a process that is similar to their process, where they, again, require the health plans to do a filing showing that they're meeting the requirements. Then CMS uses software to determine whether or not the plans meet the requirements. And if the plans do meet the requirements, they're approved as one step towards certification as a QHP and entering the market for open enrollment of that year.
Zach, you work very closely with a lot of states. Are you still seeing a lot of the state-based exchanges moving in the direction to comply with these new requirements?
Yeah, we've seen several. I've had many conversations with State Department of Insurance leaders who are typically the ones that are setting the network standards and working with their state-based exchanges. One that is out in the public sphere right now is the state of Nevada. Their state exchange is moving closer to the SSIO standards. And we're seeing many states across the country that are state-based exchanges look at those requirements and move closer in order to meet compliance with CMS.
Last time when we were talking about it, it seemed like a lot of them might have to be working through legislation to be able to make those changes, and some might have to go a different route. It could really just depend on how their state is set up and what their current process is for changing those requirements.
That's a really good point. In Nevada, the State Department of Insurance was able to do that through a proposed rulemaking, but every proposed rule in Nevada has to be approved by the legislature. That's not the same in every state. In some states, the Department of Insurance or the SBE can simply change the regulation without getting that approval. In other states, the State Department of Insurance or the SBE, they don't have the authority to change the network adequacy requirements. So the legislature must change those. In one state, in Oregon, which has standards today for QHPs that really do not mirror the federal standards, their legislative session just started, and we saw in that state legislation proposed just a few weeks ago to grant the Department of Insurance there the authority to create new standards. So reading between the lines there, perhaps they'll take that authority and create standards that more closely mirror the SSIO standards after the legislative session if that bill passes and becomes law.
It's going to be a busy year.
Right. Absolutely.
Well, we look forward to learning more and getting more updates.
Yeah, we're tracking everything that's going on across the states, across the federal government. We'll continue to update listeners here and update our customers and others through other things that we put together throughout the year.
Fantastic. Zach, thank you again for being here today. And thank you to everyone tuning into this episode. If there are any network adequacy or provider directory accuracy policies you'd like us to cover on the podcast, let us know in the comments below. Also, if you're looking for more information on today's discussion, visit our QHP Marketplace Resource Hub. Thanks again for listening, and we'll catch you in the next one.
Thank you for tuning in to this episode of the Totally Adequate podcast. If you enjoyed it, we'd appreciate it if you could rate us on Spotify or leave a review on your preferred podcast platform. Your feedback helps us grow and bring you even better content. We also invite you to send us any comments or topic ideas by emailing us at thetotallyadequatepodcast@questanalytics.com. The Totally Adequate podcast is produced by Fowler House Films and Quest Analytics. Thank you for listening.